Let's bring back our powerhouse panel for the morning. The author of Words for Warriors, Sam Sorbo, is with us. Political analyst extraordinaire Mark Halperin, always great to have him. National Advisory Board member for Project 21, Christopher Arps, and former acting director of U.S. National Intelligence, Ambassador Rick Grinnell, who is with us. Okay, folks, President Biden's approval ratings, take a look. The gap is widening there. And now Dr. Fauci gets on the Sunday shows and starts talking COVID again. Not hopeful in the months ahead, especially when it comes to Christmas. Is Fauci going to cancel Christmas or try to yet again? Take a listen.
But we can gather for Christmas, or it's just too soon to tell?
You know, Margaret, it's just too soon to tell. We've just got to concentrating on continuing to get those numbers down and not try to jump ahead by weeks or months and say what we're going to do at a particular time. Let's focus like a laser on continuing to get those cases down, and we can do it.
Focus like a laser on getting the numbers down.
Tom, can I just jump in here?
Please, Rick, jump in on this.
You know, we're all focused here on Fauci's answer. But come on, Margaret Brennan asking this question. Why do we care, right? Why do we care? Let's go to Mark on this. Mark, why is a reporter asking Dr. Fauci for permission to gather her family at Christmas, knowing full well we've been gathering all summer, July 4th, Labor Day. We will gather for Halloween, for Thanksgiving. We are gathering for Christmas. Why is it that a Washington, D.C. reporter is asking for permission? What's going on in Washington?
That's a great point.
Fauci's like the Wizard of Oz for many in the Washington press corps. He's all powerful and the man behind the curtain, and they want to know what he thinks to get permission.
Yeah, I mean, but it's just the power of this one individual who hasn't, I don't think he's seen a patient in 40-something years. And by the way, it gets worse. He starts talking about masks again. Listen.
Even if you are vaccinated and you are in an indoor setting, a congregate setting, it just makes sense to wear a mask and to avoid high-risk situations.
Sam, this is never going to end. These people do not want to let this go because it's about dominion and control. Your thoughts?
Well, it's people choosing tyranny over common sense, really. And the sad thing is that we have probably more than half the country that is now on board with that. Please, sir, may I have some more? This is people choosing to have overlords instead of choosing freedom. This is completely anti-American. This is why I wrote my book, Words for Warriors, and why I'm such a staunch advocate for parents pulling your children out of school, because our public schools have taught us to toe the line, to listen to, the quote-unquote authority, even when that authority has been proven wrong time and time again, even when that authority has been involved in the creation of the problem that we are now dealing with. Even then.
Right. Yeah, absolutely. And, you know, FDA Commissioner Dr. Scott Gottlieb was talking about vaccinating kids as well, Chris. Listen to this.
I think it's inevitable that the COVID vaccine is going to be incorporated into the childhood immunization schedule. CDC ultimately has to take that up. My guess is they're not going to take that up until you have fully approved vaccines for children, until you have more than one vaccine in the market available to kids.
Even though it doesn't work.
Well, that's the whole thing. I mean, first of all, it's not medically necessary. I think that if you look at the CDC's data, it's not medically necessary. But let's talk about, Chris, let's talk about Scott Gottlieb here. This guy is now on the board of Pfizer, and he is being presented now as sort of a disinterested party offering medical advice. You understand why, now you can understand why people question the credibility of what they're hearing on television.
Yeah, I mean, you have skeptics out there that think that this is just a money power grab for the pharmaceutical companies. That's why they want to vaccinate everyone. And like you said, the CDC numbers said that if you are under 45 years old, your chances of dying from COVID is like 1.9%. this disease does not affect children, but they want to vaccinate them for their plan to vaccinate everyone. I think it's unnecessary. You know, when you have rubella, measles, diphtheria, those were things that I was vaccinated for as a child. If you got those diseases, you were pretty much going to die. But with COVID-19, we've seen that the chances of dying for children is very low, and this rush to vaccinate children is something I just don't understand.
It's actually 0.015, I believe.
We need to hear from the mental health experts. They're not speaking up enough. Mental health experts need to tell us what the problems are with masks on children more.
Yeah, absolutely. All right, thanks, panel. We're going to see you right after the break.